Hello, this is Kinsey. I'm a physical therapist at Fit Muscle and Joint Clinic. I'm excited to bring you the second in our series of interviews with physicians around the Kansas City area. If you missed our last one, we had an opportunity to chat with a local expert on migraine care, so go check that one out. But today I'm excited to be chatting with Dr. Michael McCabe from Apex Orthopedics. Dr. McCabe is an orthopedic surgeon with the Sports Medicine Fellowship and additional expertise in hip arthroscopy. He's also the sports medicine provider for Raypec, Grandview, and Belton High School. Prior to working for Apex, he was also at Walter Reed National Medical Military Center. So Dr. McCabe, thank you for joining us today. And please tell us a little bit about your practice.
Thank you for the invitation, Kinsey. It's good to do this. And getting on within 30 minutes of start time is actually a big success with online live stuff now. So my background, as you said, I traveled around a lot before settling here in Kansas City, and been happy with the new home, and we're here to stay forever. So my particular interest developed when I was at Walter Reed did my fellowship in sports medicine. And then when I was at Walter Reed, we were specifically working in the sports medicine field, and there was a special need with the active duty military and actually their dependents as well. So the family members too, who had quite a bit of hip problems. And so there was a special interest that grew out of that task specifically. And so that's where the origins of my particular hip arthroscopy practice began. And that's a fair amount of what we focus on in our team these days, and much of the work we're doing. So my particular practice is heavily sports medicine related, but we see shoulders, elbows, knees, and hips are what I focus on, and a certain amount of general orthopedics as well. Certainly we do with fracture care and things like that.
Sure, definitely. So tell us kind of your journey here. So from Walter Reed Medical Center, did you come straight to Kansas City, or how did you find your way to Kansas City?
Well, my origins go all the way back to my childhood. I grew up in St. Louis, but my mom I grew up on a farm in Kansas, in Lawrence. And so we've always had a Lawrence, Kansas connection. And so my older brother went to KU and took a job here out of college. And so that was the origins of the attraction to Kansas City when I was getting out of the Navy. My particular education although he went to KU, I went to Notre Dame in Indiana, and then did my medical school in New Orleans at Tulane, and then moved around for residency and fellowship, and then ended up at Walter Reed in Bethesda for 4 years. And then when I was getting out of the Navy, I was looking for a place to be, and we wanted to be closer to family, wanted to be back in the Midwest. And so our children are now going to have the opportunity to grow up with their cousins. And so that was the biggest draw with Kansas City.
Wonderful. So back to some hip and orthopedic questions. So I'm sure you have a lot of people coming in very frustrated. They've been dealing with persistent hip pain or general pain for a while. When they come into you, how do you decipher between if it's absolutely necessary to have surgery or if they should go with a more conservative approach?
So we see people on both ends of the treatment spectrum. Sometimes the last thing they ever want to do is come in and talk to a surgeon. And so they're spending quite a bit of time with folks like you, especially in a chiropractic office or a hybrid type of a practice like you all have with chiropractic and physical therapy, and basically really pursuing all those non-surgical treatments that are out there. But then we also might see someone who has a different perspective, says, well, let me go visit with the orthopedist and make sure that there's no impending doom going on here with the hip or joint or whatever. And then, so we might start them with the physical therapy on one hand, or we might catch them at the end of the physical therapy or at treatments that aren't working. And so where we come in, that I think serve a big role for the continuity of the medical care that's either been started or is getting ready to get started is x-rays. And we make an x-ray diagnosis at the first visit and can get a lot of information from the x-rays, which is a nice, cheap, straightforward, readily available, easy and quick option that we have. And then we can kind of even decide, do we need to spend the time or do we need to spend the money on an MRI, or is your time and money better spent with some simple treatments that a therapist has expertise to handle? And then really what it comes down to is there are a lot of things that might qualify to be surgical or require surgery, but if you can get that joint feeling better without an operation, then usually that's sufficient. There's very little things that we take care of on a regular basis that we say, no matter what, you have to have surgery on it. And this would be excluding certain things like acute trauma. So if you fall and break an ankle, There's no getting around it. It might need that thing. But if we're looking at your overuse injury, maybe our CrossFitters or maybe martial artists, dancers, recreational athletes, high school athletes, all those sorts of people, maybe they just need to modify their activities a little bit. And if that works, then usually we're done.
Okay, perfect. And now, so if you send someone to physical therapy or any sort of rehab, about how much time do you expect for them to start seeing results before you have them come back and check in with you? How many weeks or months would you?
We maybe say, give or take, somewhere in the 4 to 8 week time frame. I like to see if I feel like therapy's the best option, then we really should be seeing some type of response within a couple of visits typically. Now, there are always cases that are going to take more work, and these treatment plans might go on for several months, but as you know, you might do 3 or 4 visits or 3 visits a week for several weeks, and then you transition them to a home program. So we'll usually have about maybe give it a good month or 2 to see how it's doing, and then when the dust settles, are we better off than when we started, and is that sufficient? If it is, we're done. If it's not sufficient, then we maybe look into the next step on the orthopedic surgery side of things.
Okay. And if they do have surgery, what time frame do you usually give them to be back to normal? So say you have a high school athlete or a college athlete with the torn labral repair, it is decided that they do need to have surgery. How long typically till they're back to game ready time?
So specifically with the hips, we usually will start a return to run program around 3 months, and that's the baby step. So we always have to talk the athletes through return to run for you is different than return to run for a physical therapist. So you might run them for 30 seconds or 60 seconds. And to them, that's nothing. They want to run for 30 minutes or 60 minutes. And so we start that return to run program around 3 months, and then we're reintroducing the sport specific exercises over the next 1 to 3. And so we like to target about 6 months post-op for return to sport. There's some decent science that says that although they can do that, they still may not feel quite right. They may not feel whole and 100% for a full season later.
Okay. And is there certain factors that predispose an individual for a labral or a hip labral tear, or anything, any particular athletes that you see more frequently than others?
So certainly the anatomy that the patient has, which we can recognize on the x-ray, is going to be the first thing. And we have the little manual analogy we use frequently is if we've got the ball and socket right here and we have a nice slope, this is what we're really focusing on as in the head of the ball and then the neck. So we want to see a nice slope right there so that hip fits in the socket nicely. Now, if someone is born or develops like that with a big bump right here, you can see it just doesn't fit in the socket as well. And that abnormal motion right here, that bump can hit up against the edge, and that's where we'll get our labral tears. And so the x-ray will give us that information right off the bat. So we rely pretty heavily on that. And then in terms of the high risk activities, I see a whole lot of soccer players, but I don't necessarily think that soccer is more dangerous. I just think it's such a popular sport right now, and the amount of revolutions that they're putting on their hips, they're just running and running and running. Mm-hmm. We also see quite a few dancers with labral tears because the high flexion activity that they do, and you can kind of pair up gymnasts with that group as well. And then martial arts is a pretty common injury that we'll see as well, simply because of the high flexion that they're doing with the hip also.
Okay. And do you see more younger, older, certain populations, or male, female, anything in particular that you see more of than others?
Well, when I was in the military, I certainly saw a lot more males. And then when we transitioned to the civilian side, I saw quite a few females. And I would say that the majority of what we're doing, slight majority, is probably female hip injuries. And, this is something that you might see as young as 13 or 14 years old. But we probably have the highest ratio of people in their teens and 20s or 30s and 40s. Once sort of life catches up, you slow down a little bit, having kids and working and such. We'll sometimes see the hip problems set in around that stage of life.
And do you see the conservative approach working better with certain demographics, the more conservative approach with the younger or the younger athletes, or more with the older population that are the weekend warriors?
I don't know that I'd be interested to know what your thoughts are on that with your experience with physical therapy. I think there's a consistent theme of people where it works. I don't know if there's necessarily one age group that's more favorable or not, at least from what I've seen.
Okay. So now to some very serious questions.
All right, I'm ready.
When everything is back to normal, hopefully here soon, what restaurant are you most looking forward to going to?
If it's with the boys, then it's probably going to be BRGR, and we're going to order burgers for everybody. It's my wife and me. Then we're going to go find Italian.
Italian. And what are you going to order at both places?
Pasta with red sauce. If we're going Italian, and then kind of a spicy cheeseburger.
All right. So speaking of the kids, what have you been doing to keep everybody entertained during this time of quarantine?
Well, I would have to say the last few days have not been ideal with the rainfall, but I feel like the first about 6 weeks of it, we were all very lucky in Kansas City just because it seemed like the weather on the weekends was opening up pretty consistently. And so we spent a lot of time outside, learned some new tasks and hobbies and things. And we got the 4-year-old on his 2-wheel bicycle, and then the 2-year-old learned how to do a scooter. So that made them mobile. And so we've had some good walks around the neighborhood.
Wonderful. Now, are you having to show them all these skills? Are you doing the scooter and the bike and everything?
I put the elbow pads on you and give it a go.
Wonderful. So now if you have nothing to do, no expectations, and someone's watching the kids, what are you going to do? Are you going to read? Or are you going to watch something? Or are you going to, what's your nerdy guilt or your nerdy kind of like guilty pleasure?
It's just me, nothing to do. I'll find a project around the house, see if I can fix something that I like to keep my hands busy, and similar to what we might do in surgery, but something that doesn't have the intensity of concentration and stress and such. So that's my go-to, is find something that needs to be fixed and see if I can solve it. And
fix it. There you go. Well, thank you very much for your time, Dr. McCabe. It was wonderful to kind of get to know some more information about hip labor repairs and your opinion on those things. He's a wonderful surgeon, and we see all sorts of his patients over here, and of course they're always a success. So thank you very much for your time, and we'll be talking with you again soon.
Well, thanks, Kinsey, and I appreciate what you all do with your combined approach. I think musculoskeletal medicine is complicated, and to have a more systematic but also comprehensive approach is a big deal. So keep doing what you guys are doing. Okay.
It's a great partnership. Well, have a great day, and thank you for joining us, everybody. All right. Bye-bye.
Bye.